patients have received or are receiving the optimal care, I think these challenges or these changes in the care with the imposed changes in the diabetes clinical care in general should be well understood for us. So what we have in when we start to talk about the data between diabetes and COVID-19. Actually, diabetes and virus infection in general, it is not a new issue. Diabetes is well known as a primary risk factor for development of pneumonia and septic cause related to virus infection in general. And this have been reported and noticed in the literature in approximately 20% of the patients with diabetes have increased risk to contract viral infection and to develop severe form of pneumonia. Also, it has been reported that COVID-19 associated with hyperglycemia, particularly patients who are a bit elderly with type 2 diabetes. This frequently presented to the clinical setting with maybe more frequent hyperglycemia. And the fatal outcome for COVID-19 has been found to be 50% higher in the diabetes patient compared to non-diabetic. So we can say maybe diabetic patient and maybe at significantly increased risk for developing or going to the fatal outcome of COVID-19. And for us also to understand how maybe what is the reason, what is the rationale behind this severity of COVID-19 in diabetes, of course, may be attributed mainly to 2 points. The first one, diabetes in general, as we highlighted, all the M form bring the patient at higher risk to contract infection. Okay, so this is the first point. The second point, older diabetic patient, of course, most likely they have concurrent cardiovascular disease, and this one again will bring more adverse clinical outcome in clinical setting for diabetic patient. So it is primary risk factor. Hyperglycemia is more, the fatal outcome is more. We can see here from this table, the latest data from published from Italy, I think, have been identified what the observed common comorbidity in deceased COVID-19 patient. The patient who are deceased have already, the fatal outcome has already been happened. What about the comorbidity? We found that you can see here that 31.3% of them were having diabetes either alone or with some other comorbidity, which maybe in 50% of the cases they have 3 or more comorbidity at one time. So it is maybe a significant link between diabetes and COVID-19. Here, what makes diabetes and COVID-19 maybe very relevant when we talk about medication. Actually, there is 2 specific mechanisms, and I think as a pharmacist, we hear about this one. We hear about the debate whether to use maybe ACE inhibitor and DPP4 inhibitor. And actually, this specific mechanism is based on, as all of us know, the angiotensin converting enzyme 2, the ACE2. Okay, it is a receptor for the protein of the virus. And this ACE2 normally have anti-inflammatory effect. So when the patient developed the infection, COVID-19 infection, the COVID-19 infection reduce this ACE2 expression, means promote inflammation. That's why it has been reported in many settings that COVID-19 most likely to have hyperinflammatory response. With the concurrent respiratory failure and cellular damage, hyperinflammatory response. And patient with diabetes who develop or who has hyperglycemia in acute setting was found this one to be upregulating the ACE2, so more virus will come. While those on chronic hyperglycemia means there is no diabetes control for some time, will be experiencing the inflammatory damaging effect of the virus. So it is very risky to have either the acute or chronic hyperglycemia. Both of them are very risky to the patient. In addition to that, the ACE2 expression, the receptor, this one, also have shown to cause damage to the beta cell in the pancreas. And this one was thought, this may be the basic cause or the rationale for frequent cases of severe DKA among diabetic patients with COVID-19. And also, it has been noticed in the clinical setting that those patients have to receive higher insulin requirement compared to any other patient in their presentation, severe course of infection. So the first specific mechanism, diabetes and COVID-19, will be related to the ACE2 expression and the inflammatory response. What about the second specific mechanism, which also related to diabetes? Of course, one of the common diabetes medication, the dipeptidase 4 inhibitor. Just to highlight this, the DPP4 as an enzyme, it has a role, of course, in the glucose and insulin metabolism, and maybe increase inflammation. That's why the DPP4 inhibitor will have a control effect on the glycemic level, and was thought to have anti-inflammatory effect. And this has been shown previously against different version of the coronavirus Erasmus Medical Center 1, MERS. So from this point, it was thought also that diabetes treatment with DPP4 inhibitor can have some beneficial effect on the inflammatory pathway, can have anti-inflammatory effect. But this one proved, and now it is not well established, and we'll talk about this later when we talk about the medication. So I think the first part, COVID-19 and diabetes, we highlighted. So COVID-19 and diabetes increase risk of the fatal outcome, increase risk of severe presentation of COVID-19. The uncontrolled diabetes from both sides will be associated either by enhancing the virus presentation into the body, or promoting or aggravating the inflammatory response. Now we move to the second section. Second section of this talk is about what actually the implication of COVID-19 on diabetes management. And for this one, as we highlighted, we have three main points. We'll discuss three main points: glycemic control, metabolic control, and what the special consideration for drugs used to treat diabetes in the patient in clinical setting in general, hospital or clinical setting, or community pharmacy setting. So first of all, glycemic control. I think we have touched on this one when we talk about how acute hyperglycemia and chronic hyperglycemia contribute to the severity of COVID-19. Just to conclude that patient in general with suboptimal diabetes control, any form of suboptimal diabetes or glycemic control, in general will be at higher risk of acquiring infection. And the epidemiology data coming from China and Italy has highlighted that the subgroup, there is certain subgroup of patients are significantly even higher risk. First, those may be uncontrolled, hemoglobin A1C elevated among those with type 1 diabetes, and those have been shown to the immune response for this patient is very weak, and will be more susceptible than other even diabetes patients for the infection. The same goes to the type 2 diabetes with concomitant fatty liver disease. Those patients also has been maybe found to have increased risk for COVID-19 disease. And in those patients, the inflammatory effect, the inflammatory response is much more pronounced.